Welcome to Nursing School Explained and this video on cardiogenic shock. Whenever we talk about the heart's function, we have to refer back to this important formula: cardiac output equals stroke volume times heart rate. And that really refers back to the pumping ability of the heart. The cardiac output is comprised of the stroke volume, which is the volume of blood that the heart pumps in 1 minute, multiplied by the heartbeat, so how many heartbeats we have per minute. And the cardiac output is so important because it is what provides the nourishment, the blood, the oxygen to all the tissues in the body, not only the important organs such as the heart, the brain, the kidneys, but also all the digestive organs and every cells of the musculoskeletal system all the way down to the pinky toes. So we really have to always keep this formula in mind. And when we talk about cardiogenic shock, then there's something wrong with the heart's ability to pump or fill. Hence we have causes, can be either systolic or diastolic in nature. Recall that systolic function is the ability of the heart to pump, where diastolic function is the passive filling of the heart chambers during the rest period, during the diastole period. And so when we have pump failure, systolic failure, that is the most common cause is because of myocardial infarction. So there is now part of the heart that has been infarcted or is ischemic and therefore can no longer pump as efficiently. So that heart muscle is not able to pump and produce that cardiac output. But we also mostly think about left-sided heart failure when we talk about systolic failure, but it can also be diastolic, meaning right-sided heart failure or fill failure. And that is really because once the left ventricle fails, things will start to back up the opposite way of the normal blood flow into the lungs, and then therefore the right side of the heart eventually will be affected as well. So pulmonary hypertension, which is a cause that originates in the lungs, can also lead to systolic failure here. And then cardiomyopathy, sure enough, when the heart muscle itself is diseased and is not able to contract as efficiently, that can be a cause of cardiogenic shock as well. Now for diastolic, so filling pressures, cardiac tamponade would be when there is excessive pressure on the outside of the heart itself. So when there's a constriction, the heart can't pump, so it can't fill. And then ventricular hypertrophy, as discussed, as well as cardiomyopathy. But again, the most common cause is because of myocardial infarction. And then certainly dysrhythmias, Brady dysrhythmias as well as tachydysrhythmias can cause cardiogenic shock. So if the heart is beating too fast or too quickly, it can cause trouble that lead to cardiogenic shock. And then structural defects, so any kind of valve disorders or congenital heart defects can also lead to cardiogenic shock. And please know that I have videos on pretty much all of these topics that you have here, so refer back to those to the more detailed pathophysiology.